Hi, my name is Dr. Dany Raad, and I'm a gastroenterology fellow at University Hospital's Case Medical Center in Cleveland. I'm going to talk about my study entitled Role of the Cold Biopsy Technique in Diminutive and Small Colonic Polyp Removal, a Systematic Review and Meta-Analysis. So the reason that led me to do this study is that I've noticed that people have used different techniques in removing the diminutive and small colonic polyps. And right now, these are the most commonly encountered polyps in our daily practice, and we believe that the removal of this polyp delays the progression of the adenoma-carcinoma sequence and the subsequent development of colon cancer. There are several techniques that people use for removal of those polyps. We conducted a systematic review in order to compare the incomplete histological eradication rate using the cold forceps biopsy technique versus all other techniques, which included the cold snare technique as well as the jumbo forceps biopsy. So out of almost 3,800 citations, we identified a total of 5 studies that included almost 720 patients, and all of them which assessed the incomplete histological removal rate using the 2 different techniques. So overall, there was a significantly increased rate of incomplete histological eradication using the cold forceps biopsy technique by 40% as compared to the other techniques, the jumbo and the cold snare technique. And so overall, out of the, if you remove, which that translates is that if you remove 1,000 polyps, there is 119 of those polyps will be incompletely resected if you use the cold biopsy technique. However, you can decrease this rate by 60% if you use any other technique like the cold snare or the jumbo forceps. In addition to that, in a subgroup analysis, we found that the cold snare technique specifically was associated with a 79% increased complete histological eradication as compared to the cold forceps biopsy. And both these techniques did not prolong the study and did not prolong the total procedure and did not have any increased adverse events. So right now, there are no guidelines on the different methods to remove those polyps, the diminutive and small colonic polyps. There are only expert opinions and endoscopist's preference. I believe that this study strengthens the need to use different techniques other than the cold biopsy techniques in order to remove those polyps. For example, if you do find a polyp in the colon that is easily taken out of a cold snare, you should probably use that technique instead of the cold biopsy. And however, if the polyp is at a certain angle or a certain position that is difficult to ensnare, then you should consider using the jumbo forceps biopsy instead of the regular cold forceps biopsy in order to achieve a higher complete histological eradication rate. Hopefully, this study will strengthen the existing evidence that cold biopsy techniques should be used less and less in the removal of those polyps. So in this study, we used the nationally known the grade approach in order to rate the quality of our evidence. And one of the tables in our study assesses the methodological quality of all the studies that were included. All of them were randomized controlled trials that were pretty well done. So overall, in terms of the outcome of incomplete histological eradication rate, our strength of the evidence was rated as moderate, and it was only rated low because of the risk of bias. So overall, I do believe that this is a very well, it's a decently strong evidence to support the use of other techniques other than cold biopsy for removal of small and diminutive colonic polyps. This study adds evidence to the best way of removal of the diminutive in small colonic polyps. However, the clinical efficacy of doing that is still not yet known. So we do not know whether the removal of those small and diminutive polyps will eventually lead to a decreased rate of colon cancer, which is the goal of doing the screening and surveillance colonoscopies. I think that we will need longer-term follow-up studies and more thoroughly done studies in order to evaluate this outcome. Again, my name is Dany Raad, and I was speaking to you about the cold biopsy systematic review and meta-analysis that is now published in GIE. Thank you for listening, and please feel free to contact me if you have any questions or concerns about the study.